I'm excited for this question. 25-year-old man, high fever, severe muscles. Look at that picture. Trip to Brazil, similar illness 5 years ago, multiple petechia, hepatomegaly, and low blood pressure. What does this guy have? Say with me, dengue. Woo! Leukopenia, thrombocytopenia, elevated liver enzymes. Now, which of the following best explains why his current illness is more severe this time around? Well, antibody-dependent enhancement is the answer. Let's talk about this. How does dengue work? It attacks the immune system. The immune system attacks on the platelets. So dengue virus directly infects the bone marrow cells, right? And that reduces the platelet production. And then the immune system makes antibodies against the viral proteins, but these cross-react with the platelets, and so the platelets get destroyed in the spleen. And that causes severe thrombocytopenia, so the low platelets, and that increases the risk of bleeding and petechia. So when you go like this to your hand, whoosh, it's red, and then it blanches, and then it's white, and then it's red again, right? That's normal. Whenever you have a lot of leakage and no thrombocytopenia, so you can't even cover those leaks, no platelets, so you can't even cover those leaks, the blood will just leak out and it won't be able to be removed whenever you push on it. And that's why it stays, and it's essentially your blood is all over your body, so it's petechia. Capillary leak syndrome as well. So dengue will infect the endothelial cells, and that will trigger the massive inflammation of TNF-alpha, IL-1, and IL-6. That makes the vessels leaky, and so the plasma leaks out. You get edema, you get liver congestion, you get kidney injury, brain swelling, all that stuff from the leakiness. So the platelets get destroyed, yada, yada, yada. That's kind of how this all works. Okay, so why is the second infection worse? So dengue virus has 4 serotypes. There's DEN1 to DEN4. All right, so we'll scroll down right here. We have these infections, high fever at first. They call it the break bone fever, super bad, and there's a rash, leukopenia, self-limiting. But then the second time around, you get the big leakage. Okay, so there are 4 serotypes. Primary infection provides immunity only to that specific serotype. And then later, the immune system makes a non-neutralizing antibodies that can't fully fight the new virus. And instead of stopping the infections, these antibodies actually help the viruses enter the immune cells. That increases viral replication and worsens the symptoms. That's antibody-dependent enhancement. They're going to just latch on to those antibodies that you made through a different serotype. That's all they're going to be doing. In dengue shock syndrome, severe vascular permeability causes the plasma leakage, hypotension, and shock. So that's the severe case. Other choices, antigenic drift. That should make you think of flu, the influenza, not dengue. So if a virus gradually mutates, just think antigenic drift. It's going to be influenza. Blunted T-cell response is wrong. So with blunted T-cell response, dengue is a secondary infection and has an overactive T-cell response. Infected cells display viral antigens and trigger the excessive T-cell activation, and that worsens inflammation and vascular permeability. So if the virus evades the immune system, then think HIV or cytomegalovirus. All right, so an increase in viral inoculation size. We'll scroll down here so you can see this answer choice. This guy. Dengue does not depend on viral dose. What does is hepatitis B and rabies. Tons of rabies, that's bad. Tons of hep B, bad, bad, bad. That can worsen the infection, exacerbate the problem. Viral superinfection is wrong. Superinfection is whenever you get a second virus infects a person who's already infected by a different virus, like Hep D infecting a patient with chronic Hep B. It's not a superinfection. It's just a different serotype. Okay, well, hopefully this is helpful. It's just different exposure to a new genotype upsets the endothelium and causes leaky damage. And so that's why our correct answer is going to be an antibody-dependent enhancement, because it depends on the antibodies from the first one. Peace out.